Hello and welcome, and thank you for joining us in today's EUHealthGov event. We're thrilled to welcome Elizabeth Kuiper for a practitioner perspective on putting health on the agenda. Before introducing our speaker, I'd like to introduce the context of this event very briefly. For those of you who don't know as yet, EUHealthGov is an interdisciplinary research network funded by the University Association for Contemporary European Studies, EUHealthGov, and is supported by the Erasmus Plus programme of the European Union. The network is coordinated by Dr. Eleanor Brooks at Edinburgh University, who's also on the call today, Dr. Charlotte Gajewski from City University of London, and myself, Dr. Mary Guy from Liverpool John Moores University. This event is part of our network's online quarterly seminar series, which we've been running since approximately May 2021. These events have included presentations by academics of work in progress and recent publications, as well as roundtable discussions, and more information is available about these events on our website, EUHealthGov.org. For today's event, which is our third practitioner perspective, we are honoured and excited to welcome Elizabeth Kuiper. Elizabeth is Associate Director and Head of the Social Europe and Wellbeing Programme at the European Policy Centre in Brussels. Since joining the EPC in 2022, she has led on linking up EPC research on healthcare, social equality, sustainability and economic governance, and this has generated a range of publications and events on topics as diverse as the EU pharmaceutical strategy, the Ukrainian healthcare system, digitalisation and health, and the perennial topic of health in all policies. This current focus and role builds on Elizabeth's background as Executive Director for Public Affairs at the European Federation of Pharmaceutical Industries and Associations, as well as national and EU-level roles relating to health policy. Our focus today is on putting, and indeed keeping, health on the agenda. The rapid spread of the COVID-19 pandemic across Europe in early 2020 led to health receiving unprecedented attention, not just at the EU and national levels, but in terms of the link between EU activity and health. This prompted questions to be asked about what does the EU do regarding health, and it also underscored the national competence for healthcare as distinct from public health. Whether and how the experience of a global pandemic is enough or is what's needed to give health a definitive place on policy agendas can invite discussion across academic disciplines and across different practitioner groups. And I'm very pleased to see both reflected in our audience today. And today we're able to take some time to reflect on this, the position of health on policy agendas. And we're grateful that Elizabeth can join us to share her insights into putting health on the agenda and EPC's work in this area. Before handing over to Elizabeth, just some brief housekeeping. Please note that the event is being recorded. We therefore kindly ask you to mute yourselves to avoid disruption and distortions. The format will be a 15-20 minute presentation by Elizabeth, followed by a brief discussion, and then we open the floor to questions. So please feel free to put your questions in the chat and make use of the raised hand function at the end of the discussion, and we will try and cover all questions we receive. So Elizabeth, welcome to EUHealthGov. Thank you, and the floor is yours.
Thank you so much, Mary, and good afternoon, everyone. It's really a pleasure and honor to be with you this afternoon, and I'm really looking forward also to the exchange. Because as you said, Mary, in your introduction, I think at this moment in time in the European Union and beyond, we are dealing with a lot of interconnected challenges, and they have to do with the current geopolitical context, currently also the cost of living crisis and growing inequalities, also stemming from that context, changing demography, which is important, of course, for the population, but also clearly for the health workforce that I will come back to later on. And I think all of that, of course, got put into context by the COVID-19 pandemic. And I think it's a really important moment in time to reflect on what COVID-19 has brought in terms of the learnings about healthcare systems, about public health, but certainly also about the competences for health at EU level. And in that respect, I'm very happy to take you with us this afternoon about what the European Policy Centre does in that respect, but certainly also what we can do all together as stakeholders working in the policy sphere. Because if you think back about where the European Commission started in December 2019 and where we stand now, a lot has changed. I think it's important to recall that already with the current President von der Leyen, when she started as President of the European Commission, her ambitions for health seemed higher than for the previous commissions, because I think we all may recall the time when, especially President Juncker, always mentioned health as, well, that is something in the category of focusing on smaller things is not really what the EU does. So he had this famous quote about being big on big things and being small on small things. And unfortunately, I'd say, especially for us working in the healthcare context, health was always considered to be a small thing. And I think, again, a lot of us question whether actually that is right, even at the EU level, even when you speak about a cross-border dimension of health. And I think it's fair to say that already President von der Leyen, when she was still president-elect, had a different assessment as to what she wanted to do in terms of her ambitions for health. Because when she started, and you may recall that in December 2019, she sent a letter to her then Health Commissioner Stella Kyriakides with the assignment of putting together a strategy for the pharmaceutical industry and ensuring that the pharmaceutical industry would deliver on innovation on the one hand, but also on access and equalities on the other hand. That was just 4 months before the COVID-19 pandemic started. So you can only understand that indeed a lot has happened ever since. And not only when it comes to the knock-on effects on healthcare systems, think about the health workforce. I think we all remember the time when at 8 p.m. in the evening, we would clap for the health workforce, for nurses, because of the fact that they were under a lot of pressure. And still, I think they deal with the aftermath of COVID-19 when it comes to catching up with waiting lists, with the effects of COVID-19. But clearly also the test that healthcare systems came to put to it. The resilience of healthcare systems really were under pressure. A lot of, I think, focus on have we invested enough on healthcare systems, or indeed how do we see investment in health versus the cost of health. I think, again, that all was put into context at the start of COVID-19. And I think it was the French President Macron who already in May 2020, so just a few months after the start of COVID-19, mentioned that indeed we needed une Europe de la Santé, which I think was quite interesting because also for myself, and I've been working in Brussels since 2010, so it's already for some time that indeed I am involved in discussions about, well, what are the competences for health at the EU level? And I sometimes jokingly say that it's a bit of the story of my life, that if I tell people that I'm working on health and health policy making in Brussels, that people look at me somehow sad and say, well, that's not the most important topic in Brussels to work on, right? And I always explain them, yeah, well, it is. I think there is much more competences already before the start of the pandemic than people perhaps expected. And I think the role of the EU, and especially in the current geopolitical context, is very important. So again, the fact that then a head of state would call for more health at EU level was, I think, very interesting. And indeed, ever since we have got more competences for the agency at EU level, the ECDC and the EMA, we have more competences to deal with pandemic preparedness. There's now part of the Commission, HERA, that deals with future pandemics and preparedness for future challenges that the EU has to deal with in the context of health and research. So indeed, a lot has changed. And I think the big question, as we're looking at it now, is what does the European Health Union really mean? So that was the reason indeed for me at the European Policy Centre when I started to think about a project that looked into, are we speaking about a rather narrowly defined European Health Union, or is this more an aspiration that the European Health Union is now at its start, but we would like to evolve it over time? Because again, if you take into account the challenges that Europe is facing with demography, health workforce, declining workforce, but also declining population in terms of age and health, growing inequalities, the cost of living crisis, I think it's clear that health is getting more and more important. Not to speak about the challenge of the planetary health approach, where clearly also the pandemic has shown us that indeed there is a clear intersectional link between human health, animal health, and planetary health. So with that in mind, indeed, we started the project, and Mary, it was great to also have you involved to ensure that we had the right level of also academics involved in the project, but we also had a patient representative, we had indeed a health workforce. So we really ensured that with a broader coalition, we looked at where do we stand now, where we have indeed a European Health Union that's clearly defined by the Commission as pandemic preparedness, the European Health Data Space, the Global Health Strategy, the Pharmaceutical Strategy. But that's it. That's indeed what we consider to be the health union with a few specific pillars. But then when that's ready, that's how we're going to deal with health for the future. And clearly we have been working on recommendations to ensure that this is not the end point, but rather the starting point of more health at EU level. And again, I think, especially given the Russian invasion in Ukraine, we have stayed away a little bit from questions to do with treaty change and the politics around all of that, because it's true that clearly the Conference on the Future of Europe has shown us that especially citizens are actually quite keen to see more health at EU level. It's interesting that actually sometimes politicians are more conservative when it comes to thinking about the competences of health at EU level than citizens, who time and again show, and I think that that number got only increased after COVID, that they want to see more health at EU level. And I remember that last year, indeed, when we celebrated the 30 years of the Maastricht Treaty, which of course was instrumental for health at EU level, we had indeed invited a citizen who participated in the Conference on the Future of Europe. And he clearly said, like, all the political narrative about whether or not we need treaty change, let's just be clear, we need it, because I think for all of us, it is clear that, citizens want to see their health being covered at EU level. And we all understand that, in a certain way, health is about the hospital and the healthcare systems around the corner, but it's also very much about learning from each other at European level. Because how can we justify as citizens that health and healthcare systems and medicines and innovation is just better in some countries than in other countries? Because if you adhere to that, that basically means that you say that the value of human life is different from country and from member states to member state. And I thought that was really interesting. So it's true that at the very start of the project, we had thought on also putting forward recommendations on treaty change. But I think it is, again, clear that in the current geopolitical context, where already there is a lot of discussion about enlargement and the future governance of the EU, perhaps treaty change in health is not at the immediate priority list of policymakers. So we have decided perhaps not to focus on that. I think there will be others who will be focusing on that element as well. But we have been trying to come up with very concrete recommendations as to how to extend the European Health Union. And we will present them on the 12th of September. So again, this is a preview of what we're going to publish. But I'm very happy to already say a few words about the direction that we would like to point to. Because we clearly feel that when it comes to the instruments of dealing with inequalities and access to healthcare, that we need to build on the experience of the European Commission about joint procurement. Because we have seen that joint procurement as an instrument has worked for vaccines. And of course, we all understand that perhaps joint procurement is not an instrument for all medicines, because again, if you were to do that for all medicines, we're speaking about an exercise of a massive scale, which again is not helpful, also given the fact that indeed we don't have one European healthcare system. However, if you think about a challenge for healthcare systems and for health ministers and health budget to deal with rare diseases, and especially with ultra rare diseases, it really makes sense to add up these numbers and to think about how to use the joint procurement instrument at EU level. So that's a recommendation that we clearly want to do. We know that perhaps not all member states may be in favor of this. And I think we also have to point out that member states need to be sincere, because on the one hand, we hear member states saying that they want to improve access to medicines, access to health, resilience of healthcare systems. But of course, that means that they need to invest in healthcare systems. And also the joint procurement instrument may lead to reflections from member states that actually they may not be in favor of the use of this instrument, Because again, if you make innovation available at member state level, you need to pay for it at the end of the day, even if the price is much lower than initially perhaps foreseen. So again, I think there's going to be interesting political dynamics where I think the Commission, if you ask them, behind the scenes, may be in favor of using the instrument. Whereas perhaps at council level, I expect really interesting discussions about this instrument and this proposal. So let's see indeed how that goes. Another concrete recommendation, also taking into account that it's always really interesting with health that, yes, in crisis times, as we have seen with COVID-19, health can be high on the political agenda. However, the experience also learns that once the worst of a crisis is over, other priorities take over. And I think we have seen that back in 2010 when we had the H1N1 pandemic. I still remember when I was working as an advisor for the health minister in the Netherlands that, yes, we would go to Brussels very often. There would be a lot of contacts between health ministers and stakeholders involved. But then again, already in 2010, at the very end of that pandemic, I remember that the member states had just requested the then Belgian presidency to work on a joint procurement instrument. And only by 2013, 2014, there was some interest from member states to continue to work on that. And that shows you something about health. So again, we have seen that at some point, I think it was in October 2022, Charles Michel, the president of the European Council, said very solemnly that, heads of state had been working on health issues for 16 times in a row. And again, with my Brussels experience, where health was never on top of the agenda, I thought that was a very interesting observation. But we have also seen that at the current point in time, health is not really top of list. And we need to maintain that sense of urgency. So even though the current president of the European Commission understands the importance of health, and probably indeed understands the importance of HERA in the context of how the Commission is set up, there is a risk that if there's going to be the next president who values health in a different way, HERA will be just considered as part of the Commission and perhaps wouldn't have the listening ear of the Commission president anymore. So we have formulated a recommendation to elevate the status of HERA to an agency like the European Medicines Agency and the Center for Disease Control, because it would, I think, mean more independence for HERA. It would value their, let's say, autonomous role in the context of the different agency. And I believe that if HERA isn't elevated to an agency, for them in a future crisis to be at the same level of the EMA and the ECDC will be rather hard. So I think that that's also something which perhaps is going to be important in 2024, when for the first time HERA will be evaluated by the European Commission. I think also building on the lessons learned from COVID-19, we need to think about how to address the skills gap when it comes to the health workforce. Because I think a lot has been written on the health workforce. If you think about important pieces of research also done by the World Health Organization and many others. So it's not that recommendations are lacking, but we need to implement them. And especially if you think about a health workforce, again, that's not only being in a different age group and have to do with an aging population, but also with an aging workforce where a lot of the baby boom generation will, of course, leave the workforce. But it will also, we have to deal with a lot of pressures. We have to do with different opinions as to how to value your public and your private and professional life. So people may perhaps not want to work in the healthcare sector if indeed, let's say, the challenges and the pressure in the sector isn't going to change. Clearly, also the use of data, artificial intelligence requires a lot of upskilling and reskilling for existing workforce, but certainly also for students and for how health workforce and staff gets educated. So we need to have a better implementation there throughout the Union. And of course, the challenge is that a lot of times the competences are being dealt with at national level, but there is a role for the EU also, for example, in the context of the European Pillar of Social Rights, to at least ensure that the topics remain high on the European political agenda. Again, I'm going to a few of the recommendations. So a different recommendation, but I think equally important, especially from a political perspective, is the whole concept of strategic autonomy and what it means for health. Because we also know that indeed the concept of strategic autonomy seems to be a bit of a French concept, because also here the French president has been very strong in saying we need to think more about the strategic importance of the European Union. And I think we have to be fair that indeed before the COVID-19 pandemic, I think that led to discussions about, well, is that then another way of protectionism? Is that another way of dealing with industrial policy? And I think it's fair to say that also the pandemic learned us that, yes, there is value in also perhaps producing certain medicines in the EU, ensuring that certain research, certain clinical trials are being done in the EU. Because I still remember vividly when at some point during the pandemic in 2020, India closed its borders, and indeed there was a risk that we wouldn't have paracetamol and ibuprofen in Europe. Again, we all remember, I think, the risk of not having amount of masks that we need in Europe. So again, when it comes to strategic autonomy, it's important that the European Union, but also at member state level, will implement the so-called Versailles Declaration that got adopted in March 2022, and where heads of state called on the European Commission and member states to ensure that the EU remains a high level of research and innovation. Because therefore, I think it's important to ensure that industrial policy and pharmaceutical policy stay as two parts of the same policy. Because again, what I see in Brussels is oftentimes that DG Santé is dealing with public health. That's considered one part of the equation. And that DG Grow and DG R&I, they're dealing with industrial policy. But again, they need to go hand in hand, because only when you have indeed a level of innovation and research in Europe so that you can secure the innovation for your citizens and your patients, then is also how you can address access and inequalities in let's say, the resources available for innovation and access. So again, I think the implementation of the Versailles Declaration and making it more granular on what it actually means for Europe is very important. And I think I end with, because I think that gives you a flavor of the fact that, yes, for us at the European Policy Center, the European Health Union is the starting point of a union with certain pillars that needs to be extended over time. And I think the same goes for global health, where we need to explore more partnerships at global level. I think we need to work much better with the global south. I mean, we may not find this the most useful term, the global south, but we have to work with other parts of the world in the challenges that we globally face. And a lot is already happening, but sometimes it's risk to be a sort of a one-off sometimes, where sometimes in the context of the G7 or the G20, you see that, yes, there is part of the declaration addressed to antimicrobial resistance. Sometimes there is language to do with aging populations. But I think we need to put this together in a much more holistic way. And especially if you think about the year 2024 being the year where also the pandemic treaty will probably be adopted, I think we have to think about global provisions to do with access to innovation and ensuring that when there is a next pandemic or a next emergency situation, there are also more binding provisions to do with access. Because again, we have to be grateful for the fact that the vaccines got us out of the crisis, but at the same time, we need to be also clear that we in the European Union benefited from much earlier access to the vaccines than other parts of the world. And again, preempting that and thinking more about health also from a global perspective will be very important to do all of that. So I think this is the substance of what we feel as the European Policy Center that is important to keep working on. And the big question, and that's also clearly input where I'm also interested in your opinion and the opinion of the participants, is what about the momentum for health? Because again, on the one hand, a lot of the building blocks of the European Health Union point to more substance on health. I think the fact that also in the European Parliament, there have been a lot of discussions on health. There has been even a new committee created, which is the SANT committee, which is a standalone committee for health. I think it's an important signal. I mean, personally, I was a bit mixed in the beginning because I find having a single committee working on health perhaps a bit contradictory towards the idea of a One Health approach, where actually you want to put together the human health approach together with animal health approach and with the planetary health approach. So having perhaps a stronger ENVI committee would have made sense for me. However, in terms of the political signaling and the focus and attention for health, I can see that it's an important, let's say, reflection of the commitment of the European Parliament to have the SANT committee now up and functioning. I think for me also a question is about the future governance of the European Commission and the European Parliament, because we now see, and we really see that time and again, that having a separate health directorate general is not always working when it comes to the general understanding of the importance of health. So we at the European Policy Centre also have already written a recommendation on changing the structure of the European Commission, thinking about perhaps turning the title of a commissioner, of a vice president responsible for the European way of life into a vice president responsible for the well-being economy, and the well-being economy being the concept that indeed defines well-being, prosperity in a different way, going beyond growth, beyond economic growth, and clearly also involving health and social issues. So I think that is also a contribution from our side to the discussion about how should the future commission look like, and also how indeed would the parliament need to continue focusing on health to ensure that indeed health is not seen as a separate chapter. I think that also gets reflected in the discussion about should we speak about health for all policies, health in all policies. I think the whole discussion started back in 2006 with the Finnish presidency saying, well, it should be about health in all policies. Whereas I think the current thinking is no, this is about health for all policy areas. And I think that reflects our thinking about the need for a vice president responsible for the well-being economy. So I think with that, I would like to end my introduction, because again, there's a lot at stake, a lot has been done, but I think on the need to define, keep defining the European Health Union will also define the future of health and also our role as stakeholders in the health community. So with that, Mary, I think I conclude my introduction, but I'm really looking forward to your contributions and your questions.
Excellent. Okay, well, thank you very much, Elizabeth, for that excellent overview of the work that EPC has been doing, particularly on the European Health Union, and the range of issues that come into play there. So one thing, first, I'd just like to remind the audience, do feel free to put any comments or questions in the chat, please, or make use of the raised hand function, and we'll pick those up in the next 5 to 10 minutes or so. So I'm glad you mentioned the work you'd done earlier this year on the call for an executive vice president for the well-being economy. I think that's a very interesting intervention. And the idea of having a more holistic institutional structure as a way out of the sort of cycle of perma-crisis, of course, not only COVID-19, you've mentioned already the cost of living crisis, and of course the Russian war in Ukraine and the sort of geopolitical structures as well. Can I ask you to reflect a little on whether or not the sort of institutional changes coming next year in 2024, you've already mentioned the potential for a change in Commission President to shift the emphasis perhaps with regard to the European Health Union, but the combination of a new Commission mandate, European Parliament elections, and from January, Belgium assuming the rotating presidency of the Council, how might that sort of perhaps either strengthen this idea of the need for an executive vice president, or might it be more of a threat to the European Health Union? Is there more scope for things to, as it were, fall between the gaps amid this level of change?
Well, I think that's a very good question, Mary. And I think experience and also history shows that the end of Commission mandate is always a good time to reflect on how will the structure look like under the next mandate. And I think it's fair to say that also the healthcare community has been involved in a lot of discussions about change happening when it comes to the way health has been structured at EU level. Because I'm sure that some of you remember that there was this intention, I think it was under the Juncker Commission, to actually rearrange DG Sanco, like Santé was called back in the days, and parts of it moving to the then DG Enterprise, that then became DG Grow. And again, there was a lot of, let's say, interventions from healthcare stakeholders to say, like, well, if health isn't even very visible, how would we even deal with it? And how would we even make sure there is a more holistic vision on health? So in that respect, I think the end of a mandate is always a good time to reflect. And I think especially given the fact that the current European Commission already has been doing a lot when it comes to, let's say, ensuring we have the right instruments to deal with health. Perhaps not always very visible for all stakeholders, but when you think about, for example, the European semester and the indicators that have been developed over time to indeed measure health and to also ensure that there is more understanding of health in relation and the intersection between health and other areas, I think it is important to perhaps integrate it in the thinking of how the Commission functions, because clearly a lot of good initiatives have been set up in the current Commission. I think, for example, the Recovery and Resilience Facility is another example of the fact that, yes, COVID-19, so directly a health-related, let's say, political reality led to a very big fund with a lot of budget available for investment in the green and digital transition with a primary focus on health. So I've been reading back in the days a lot of these country plans, and indeed a lot of investment, went into, for example, digitalization of hospitals and healthcare systems. So again, I think a lot of good examples are available. And a lot of indicators are available on how to measure, indeed, also the greening of the healthcare sector, the resilience of healthcare systems, investment in care systems. But we need to put them together because, again, as we have seen with the COVID-19 pandemic, for example, given the fact that member states needed to report on the RFF, the Recovery and Resilience Facility, it meant that for a while the European semester reports were put on a hold because otherwise, again, there were different rounds of reportings required from member states, and it was deemed useful by the Commission to focus rather on the reporting on the RFF, not on the European semester. So I think having a fresh mind on how do we ensure that indeed we have all indicators to measure well-being in the large sense of the world together, and also someone overlooking the areas to do with health, be it health, environment, but also, again, the financial and economic side of it. I think that is important because also for quite some time we have been speaking about cost of health versus investment in health. And there, again, it's very much on how do you use the indicators. It's not that they're not available, but you need to start using them in a much more coherent way, because otherwise you also can't prove that indeed there is value in investing in health and not just, looking from a more fiscal perspective at investments or costs. And again, that is our thinking when we propose the Vice President for the Wellbeing Economy. And again, I hear that within the Commission there is discussions going on. For example, DG R&I, I know that they have been working a lot on indicators, and they also clearly seem to be in favor of having that more holistic approach. I think it was very encouraging to see that, was it last month? No, it was already in May. There was a big conference in the European Parliament, which was called the Beyond Growth Conference, that also asked for the same implementation of the narrative about going, beyond growth and implement the well-being agenda. And indeed, President von der Leyen spoke there, and also the Vice President Šefčovič indeed spoke about the importance of indicators. So I think there are some signs that the Commission seems to be open to reflect on the thought, but I think it also depends on whether or not stakeholders ask more explicitly to make these changes. So in that respect, I feel very strongly that from a think tank perspective, we wanted to push and to propose this change.
Excellent. Thank you for that. Very interesting, sort of an insightful response there. So one thing that's really struck me about your overview of the European Health Union think tank report is there seems to be a conscious decision not to engage too much with the question of treaty change. That's been covered elsewhere. That makes, I think, a lot of sense. There are just so many facets to the European Health Union. That said, however, obviously treaty change, in a sense, speaks to the dynamic between the EU level and the member state level when it comes to health, and getting that sort of balance right. You've mentioned also the impetus from citizens perhaps being more more creative or more ambitious with this regard than politicians, perhaps. But is it still the case that this dynamic, this tension, if you will, between the EU and member state levels is perhaps something of a sort of elephant in the room, even outside the question of treaty change? Is that something that might get picked up gets picked up in different ways across the different institutions? It's reflected differently, perhaps in the Parliament. It's being closer to the citizens, arguably, than obviously than the Council.
Yeah, absolutely. I mean, like I said, I think we have seen oftentimes that the heads of state are much more conservative when it comes to competences for health. And in that respect, I think the outcome of the European Parliament elections will be very important because I think a lot of signs indicate that there may be more center-right coalitions than actually center-left coalitions. And I think history shows that when it comes to competences and to decision-making at EU levels, these parties may not be in favor of more competences for health at EU level. And again, sometimes I would say that there is a slightly hypocritical kind of behavior by heads of state, because when they're in Brussels, at least speaking for the member state that I know best, which is the Netherlands, in Brussels, heads of state would be constructive, and especially during the pandemic, of course, they would say time and again how important it is to have a more European approach, European coordination. Indeed, that there need to be thinking about the use of the joint procurement instruments and how perhaps also we could build on it, on the lessons learned. But then at the same time, and again, once the worst of a crisis is over, they don't want to face the more difficult discussions at home, especially with more Eurosceptic parties that would say like, hey, but my healthcare system is the healthcare system here around the corner. It's the hospital in my region. So are you going to threaten that if you want to give up, the competence here at national level and you want to create more competence in Brussels? I think these are very hard discussions. And as I said, in the current political context, where I think there's sometimes a lot of political revolt also to do with the green transition, cost of living crisis, we have seen that in a lot of European member states, these are not easy discussions, and they also have to do with the trust in democracy. So I believe that also heads of state perhaps are shying away because of the fact that other priorities indeed are, asking for their time. And in that respect, the discussion about will we fight for health at the EU level is not on top of their priority list.
Yep, that's very true. Yes, health remains very much at the local or national, if not local level. Absolutely. We have some questions coming through now on the chat. First question comes from Volkan Yilmaz, who I believe could be joining us from Dublin today. Volkan, would you like to ask your question, or I can read it out?
Mary, I'm not sure it's possible for the webinar participants to unmute themselves, so you might need to read those ones out.
Yep, no problem at all. Okay, so Volkan asks, Elizabeth, do you see any points of tension between health-related industrial policy aspirations of the EU and achieving equitable access to medications and medical devices?
Well, that's a very good question, Volkan. Thanks for that. I think there is indeed a discussion to be had about, let's say, investment in a true industrial policy at European level. And again, I think there's different levels one can point at. If you think, for example, about the example that I gave of having perhaps more production of paracetamol and ibuprofen at European level, that also means that the cost of doing that in Europe are much higher than doing that in India. I think we have to be upfront about it. And in that respect, yes, I think, and again, I'm using that example on purpose because I think it clearly points out that then if you were to do that, indeed, strategic autonomy in health, the provision of medicine at EU level would be something that indeed one can offer at EU level. At the same time, it also will increase prices. So I can see that, yes, there is tension perhaps in some areas, and indeed there are trade-offs that European policymakers have to be honest about. At the same time, as a European, it pains me if I hear that a lot of companies are saying that for their clinical trials, they rather go to China. Part of the argument may be about the scale of the market, which of course is much bigger than here in Europe because we don't have one single market for medicines. So you have that advantage in China. But I think when it comes, for example, to data privacy, let's say, enforcement of patent rights, etc., I think there the European Union has a lot to offer. And I think we should be very aware of the fact that we cannot let clinical trials go to other parts of the world, like indeed Asia or perhaps China, because that would mean that also innovation then follows clinical trials. And indeed, I think we all know that indeed, if you have an infrastructure that delivers, it will deliver for your patients first. So again, if Europe would be considered as part of the world where you don't do these things anymore and where you wouldn't have the innovation anymore, that would not be good news for European patients. So I think in that respect, there may be some points of tension because, of course, also Europe has much higher environmental standards. So that would mean that there are consequences also for companies, for, let's say, the red tape involved, for the rigor of implementing these standards. But I think we should be proud of that from a European perspective. We should want to be seen as part of the world where we have these standards and where we want to implement them. So I think it's actually a unique selling point for Europe that indeed we should perhaps use much more. And therefore, what I mentioned about the Versailles Declaration, and it was important to have the language back in the days in March 2022. But I think we should also ensure that we have more concrete policy that comes with the declaration. Because that also means that the tension of health-related industrial policy, as you say in your question, will be reconciled with more equitable access to medicines, for example, by the use of joint procurement.
Hey, thanks, Elizabeth, and thank you, Vulcan, for the question, for the very interesting question. Vulcan says, perfect, thanks a million. So the next question comes from Jean Margalez, who asks, sorry, I'm just reading the comment here. How could changing the treaty enhance the Commission's mandate for resource allocation? What would be the expected consequences, particularly regarding the health workforce? Because that might be the main issue for member state healthcare systems. So
yeah, that's a very good question. I mean, indeed, Mary, as you say, I think that the health workforce then indeed becomes more of European competence and would probably be easier to deal with. At the same time, I think it's also very much part of a national social welfare system. So I think it still will be very hard to see how that then practically would work. I think treaty change, especially when it comes to resources, in my mind, would be about how the healthcare council formation links to other formations. Because again, now you oftentimes have separate discussions on health. And I think, again, if we would have treaty change and if the, let's say, role of the EBSCO Council would change and become more at the level of the ECFIN Council, that convenes much more often, has more often discussions about health, indeed, is connected to other policy areas, I think then the resource allocation also would be much easier. Because I think we have to realize that the resources per se for health are much better than they ever have been. I mean, the former health program was around 450 million, if I'm not mistaken, and now it's around 5.1 billion. So again, it's a massive difference. I mean, of course, there's budget from different programs, so it's not necessarily all new money, but it's a much higher budget than we ever had. However, I think the resource allocation would be much easier if the EBSCO Council were to be at the same level of other council formations, and also the way that health ministers would connect then with other colleagues would be much easier, and I think their impact would be much more important.
Excellent, thanks. Charles snuck in just another quick question here on the role of the European Parliament, which is quite interesting. Could you explore a little more about the role the Parliament can play and how the coming elections can shape the political landscape for health?
Well, good question, Jazz. Thanks again for your questions. Well, I think that the Parliament is always very important in ensuring that topics remain high on the political agenda. I think we have seen that also with COVID-19. We also have seen that now with the Russian invasion in Ukraine, where also the Parliament has been pointing to the different aspects of the Russian invasion, where also indeed health is important. If you think about, for example, the mental health and investment in the future healthcare system in Ukraine, I think oftentimes the parliament focuses more on the urgency of issues at stake and isn't the first to focus on competences, whereas you see the other way around with member states. Member states would oftentimes first ask themselves the question, well, is there a competence in this area? And if so, what does that mean for the policy we can put in place? Whereas the parliament rather looks at the importance of the topic and the magnitude of and the scale of the issue at stake. And in that respect, again, the fact that the parliament set up a separate committee during the pandemic, the COVID committee, where Kathleen van Bremt, the Belgian MEP, chaired the committee and came up with very concrete recommendations about the resilience of healthcare systems. I think that was a very important signal from the side of the parliament. As I said, now the Sound Committee that has recently been set up and also was really a signal from MEPs about the importance of health. And I think MEPs realize that there is perhaps a risk that at political level, at the level of the heads of state, all the discussions have taken over. But the parliament feels very strongly that, yes, health is very important for all other policy areas. So what I hope, and perhaps the point that I see as slightly challenging, is that my understanding is, and also based on what I'm hearing in Brussels, is that quite a few MEPs will actually leave the European Parliament because their mandate comes to an end or will not be renewed. And of course, you can see that with new MEPs, it always takes some time before they understand, how Brussels works, the understanding of their policy area, also in relation to other policy areas. So what I hope is that some of the political strongholds that have been very active on health and has been acting as health champions, that they will remain in power so that, again, they keep that mandate and they keep that spirit and momentum. So to ensure indeed that health will remain high on the political agenda. So I hope that answers your question.
Excellent, thanks, Elizabeth. We've got a question from Ellie, but I'd just like to remind the audience if there's anyone else who would like to ask a question as we head in towards the zone of the last questions, I'm afraid. Please do feel free to add it in the chat. But what Ellie's asking is relates to the legislative files for the current commission. Do you have a sense of which are the most at threat? And alternatively, which are the most quote unquote damaging for health, if not agreed before the elections?
Well, that is a very interesting question, where indeed here in Brussels, there's a lot of speculation about which part of the European Union indeed will be finished before the elections. And I think there's two files where the negotiations are going on. The one file is the European Health Data Space, where negotiations are already advanced, and I think advanced enough to ensure that indeed before the end of this mandate they will be concluded. I think it's not without its challenges, because especially when it comes to the primary use and the secondary use of data, there is a lot of regional and national divergences. So these are not necessarily easy discussions, where especially some of the bigger member states, like, for example, Germany, where there is, of course, a history of data protection and having a very specific assessment on how to deal with data privacy and health data in general, sometimes means that implementation of the file is not going to be easy, and it means that there's challenging discussions going on. But what I understand that the previous presidency and also the current presidency is working hard to make enough progress so that the likelihood that the file of the European Health Data Space gets concluded before the end is there. However, and that's perhaps, Ellie, what you had in mind when you asked me the question, the pharmaceutical strategy got delayed time and again. So initially we were expecting it, I believe, what was it, mid last year? Then it became end last year, then it became early spring, and then it got much later, and eventually it got published, I believe it was in June only, so a few weeks ago. So there, the likelihood that it gets adopted is close to zero, because what I hear is that it's not only already a very big file in terms of the fact that there's a lot of let's say, parts of legislation that are part of the revised proposal. So it's going to be very lengthy in terms of the proposals at stake, but also the amendments that already have been provided to the European Parliament and all needs to be translated. That's going to be a lot of work. So I understood that only the translation of the text of the Commission will take till, I believe, March next year, because all the translators from, Council and Parliament need to work on ensuring that the English version gets translated in the, 24 official languages. So that means that probably during the Belgian presidency, there will be a few working parties, but the likelihood of negotiations starting during this mandate, I don't think is very high. And then, of course, for me, the big question, also taking into account what I just said about perhaps the change in MEPs' dealings with the file, is also something to take into account, because we know, for example, that Timo Wilken, German MEP from S&D, is one of the rapporteurs. From what I hear, the likelihood that he stays on is there. But then Pernie Wijs, a Danish MEP, is, from what I hear, not going to continue during the next mandate. And she's also a rapporteur for one of the other files in the context of the pharma strategy. So that means that there's discontinuation, because it means that the group needs to come forward with another rapporteur, probably that will need some time. Then if you have a new MEP that probably have never dealt with a topic per se, that means probably the MEP needs a bit more time before they are up and running. So again, I think also in terms of damaging, it's not only that when it comes to the process, I think it's damaging. I think it's damaging if indeed provisions around access and affordability have to wait much longer because of the fact that, again, we have this delay. Because again, the current cost of living crisis is already leading to more inequalities. If you think about access to innovation, we also already see a lot of divergences between member states. And I think the pharmaceutical strategy is a once-in-a-lifetime opportunity to actually come up with more concrete instruments to address these challenges. And again, if we perhaps have to wait 3, 4, 5 more years before actually this file gets adopted, and then of course it needs to be implemented. So again, we may lose another couple of years. That I think is indeed damaging in the different sense of the world.
Okay, so we have one question now. Sorry, just to follow up on that, Ellie saying that's really interesting, and yeah, regarding sort of nuts and bolts of the process. So thanks, that's something that it's always useful to know more about. So thank you for that. The question now is from Andre Isidro, my apologies for the pronunciation, and it relates to the two sides or agendas of EU health policy, which is being defined as EU health policy cooperation between member states on the one hand, and the external and active European Commission global health strategy on the other. So the question is, how do you see the two sides or the two agendas of EU health policy coming together? And is there a coincidence that they might be working against each other, for example, recruiting health workforce in the global south by EU member states?
Well, thanks, Andre, for that question. I think from where I stand, and especially given the importance of cooperation between different parts of the Commission, I actually would say that the two sides working together is a massive advantage for global health. Because what I still see in Brussels is that at working level, people are perhaps aware of the fact that there may be coherences between policy areas, but at the political level, it's not always a given. So again, I think if perhaps the External Action Service and more international actors within the European Commission work more actively or are involved more actively in health, I think that's actually an example. Because as you say, of course, when you think about recruiting health workforce in the global south, there is different angles to that problem. And I think we all have to take into account and avoid repeating past mistakes, that we don't only think, from the European perspective, because otherwise this means a massive brain drain also for the global south. So I think we have to think about this reciprocal policy making. And I think that is perhaps something that the international actors bring more than perhaps the EU perspective that may start with what is in it for the EU. But I think if indeed the different actors within the Commission are working together, hopefully you have that more holistic view, where indeed there's this reciprocal strategy that indeed works for, you know, other parts of the world as well as for the EU.
Okay, so we're coming to the end of the session, but just one last chance for a last question to Elizabeth for anyone from the audience to pop in the chat. In the meantime, I'll take advantage of my position as moderator just to ask briefly for a reflection on your experience of working with academics at different stages, perhaps in your career, in terms of national health policy, in terms of EU level health policy, and within the think tank context. From the UK academics' perspective, we're always very keen to obviously reach out and have our work sort of ideally acknowledged, and but to see how academic research, how we can make more practical use of what might otherwise, I mean, we just talk to each other basically, so having your perspective on that would be interesting. So
I think that's a great question to end the session with, Mary, because I think it's very important to have academics, because we live in a world of disinformation, and I think therefore academic rigor and research is more important than ever. I think from where I stand, because of course as a think tank we also try to deliver, you know, work that has quality and that indeed speaks to the mind of policymakers. I think where we can reinforce each other is indeed working together by also elevating your research to the policy level, because that's perhaps not your primary concern. But I think, again, a lot of what you do, a lot of the input that you provide is something that also needs to be elevated to, you know, the political level. And I think in that respect, as academics, you have also an important function within think tanks, so that, you know, both think tanks and academics can reinforce each other mutually. So in that respect, I think cooperation between you as academics and we as think tanks is very important.
Excellent. Thank you very much for that insight. And just to say thank you very much to the audience for very interesting and insightful questions. Thank you to Elizabeth for a really excellent presentation and introduction to the forthcoming EPC report on the European Health Union. Just to say, there's going to be a short summary of this event posted hopefully next week. The recording will also be available then. If you'd like to be informed of future events and activities of the EUHealthGov network, you can sign up to our mailing list and follow us on Twitter. And all the information about this is available on our website, which is EUHealthGov.org. Thank you very much, and thank you to Elizabeth for this practitioner perspective.